If you are over 60 and you have noticed changes in your stomach, your bowels, your appetite, or even the way your clothes fit around your waist, please listen carefully. I have been a doctor for more than 30 years. I have sat across from thousands of men and women in their 60s, 70s, 80s, and beyond. And if there is one thing I have learned, it is this. After 60, your gut becomes a messenger. It whispers before it screams. And most people ignore the whispers. Today, I want to talk to you gently, but honestly, about 7 gut signs you must never ignore after 60. Some of them may seem small, harmless, embarrassing, easy to dismiss, but they can carry quiet warnings that could save your life. Let me start with something uncomfortable. Persistent changes in your bowel habits. If you used to be regular and suddenly you are constipated for weeks, or you are rushing to the toilet with loose stools, and this continues, that is not just aging. Please don't tell yourself that. I remember George from Ohio, 72 years old, strong man, retired mechanic. He told me, "Doc, it's just old age. My system's slowing down." But his constipation wasn't just slowing down. It was new. It was persistent. And it came with thinner stools. We investigated. It was early colon cancer. The good news? We caught it in time. Surgery, recovery. Today, George is 80 and still tinkering in his garage. But if he had waited another year, we might be telling a different story. After 60, any lasting change in bowel pattern, lasting more than a few weeks, deserves attention. Not panic, but attention. Your colon does not dramatically change personality overnight without a reason. Now let me talk about blood, even a small amount. If you see blood in your stool or on the toilet paper, do not assume it is just hemorrhoids. Yes, hemorrhoids are common, very common, but so is denial. Margaret from Kent came to see me at 68. She had noticed streaks of blood for months. She felt embarrassed. She thought it was piles. She didn't want to make a fuss. When we examined her, we found something more serious. It was caught at stage 2. She underwent treatment and survived. She once told me, "I nearly died of embarrassment." Please don't let embarrassment silence you. Blood is never something to ignore. Let's move to something subtler. Unexplained weight loss. If you are losing weight without trying, 5, 10, 15 pounds over a few months, and you haven't changed your diet or activity level, that is not automatically a blessing. Many older adults smile and say, "Well, I could afford to lose a few pounds." But unintended weight loss after 60 can signal problems in the gut. Malabsorption, chronic inflammation, ulcers, even cancers of the stomach or pancreas. William from Texas lost nearly 20 pounds in 6 months. He thought he was just eating lighter, but his appetite had quietly decreased. Food didn't taste the same. He felt full quickly. We discovered a stomach ulcer that had been slowly bleeding and affecting his health. It could have progressed further. After 60, your body does not shed weight easily without cause. If it is happening without effort, it deserves investigation. Now I want to speak about persistent bloating. Many people laugh when I mention bloating. It's just gas, doc. Sometimes it is, but persistent bloating, especially if it's new, uncomfortable, and accompanied by pain or a feeling of fullness, can be a warning. For women in particular, ongoing abdominal bloating can sometimes signal ovarian or gastrointestinal issues. Helen from Manchester was 71. She told me she felt puffed up for months. Her skirts felt tighter. She blamed holiday food, then she blamed menopause, even though menopause had passed 20 years earlier. Her bloating turned out to be fluid buildup from an ovarian condition. Please understand this. Occasional bloating is normal. Persistent, worsening bloating is not. Your abdomen should not feel consistently swollen or tight for weeks without reason. Now let's talk about pain. Pain that wakes you at night. Pain that doesn't respond to simple changes. Pain that feels different from your usual indigestion. After 60, New abdominal pain must always be respected. I do not say feared, respected. Our pain threshold often changes as we age. Some older adults feel less, others feel more. But a new persistent pain is a signal. I once treated Arthur from Birmingham, 75 years old. He had mild stomach discomfort for months. Nothing dramatic, just a dull ache after meals. He kept taking antacids. It was not acid reflux. It was gallbladder disease progressing quietly. When we finally treated it, he told me, "I thought pain had to be severe to matter." No, pain does not need to scream to be serious. Now I want to address something many people avoid discussing: difficulty swallowing. If food feels like it is getting stuck, if you cough when you swallow, if you avoid certain foods because they feel hard to pass, that is not just aging. It can indicate problems in the esophagus, narrowing, inflammation, or in rare cases, tumors. This may be uncomfortable to hear, but it could save your life. Most people over 70 ignore swallowing changes until it's too late. Early detection makes all the difference. Next, let's discuss persistent nausea or loss of appetite. As we age, appetite naturally decreases slightly, but a complete loss of interest in food, ongoing nausea, feeling full after just a few bites, that is not something to brush aside. I remember Edith from Florida, 79. She said, "Food just doesn't appeal anymore." She thought it was grief after losing her husband. Grief can affect appetite, absolutely. But her symptoms persisted. It turned out she had significant inflammation in her stomach lining and early pancreatic disease. We treated it. She regained her strength. Sometimes what we blame on emotions is actually the body asking for help. And finally, let's talk about fatigue linked to gut issues. If you feel unusually tired, pale, short of breath, and you also have subtle digestive symptoms, we must consider internal bleeding or anemia. Slow, invisible bleeding from the stomach or colon can drain you gradually. You won't see dramatic blood. You'll just feel weaker. More breathless climbing stairs, more tired folding laundry. After 60, unexplained fatigue should never be dismissed as just age without checking your blood counts. Please listen carefully to this next truth. Aging does not mean accepting suffering. It does not mean ignoring changes. It does not mean saying, "Well, I've lived long enough." Your life still has value, immense value. Now, I want to speak about something deeper. Your gut is not just a digestive tube. It is deeply connected to your immune system, your mood, your energy, even your brain. After 60, the lining of your digestive tract becomes more vulnerable. The muscles slow. The microbiome, the community of bacteria in your gut, changes. This means you are more sensitive to dehydration, poor diet, medications, and stress. Many of my elderly patients take 5, 6, sometimes 10 medications. Some of these irritate the stomach lining. Some cause constipation. Some cause diarrhea. Never silently tolerate side effects. If a medication is upsetting your stomach daily, speak up. There is almost always an alternative. I also need to tell you something important about over-the-counter remedies. Laxatives, antacids, anti-diarrheal tablets, used occasionally, fine. Used daily for months without medical supervision, dangerous. I have seen kidneys damaged, electrolytes dangerously imbalanced, hidden cancers masked. Your body is not meant to rely on quick fixes forever. Now let me give you hope. Most gut issues after 60 are treatable, manageable, sometimes even reversible. Simple steps matter more than you think. Hydration. Many seniors are chronically dehydrated. Water keeps stool soft, supports circulation, and protects kidneys. Fiber from vegetables, fruits, oats keeps your colon moving. But increase it gradually and drink water alongside it. Gentle movement. A daily walk stimulates the bowels better than many pills. Regular screening. Colonoscopies save lives. Stool tests save lives. Blood tests save lives. And perhaps most important, listening to your own body without judgment. You are not complaining. You are not wasting the doctor's time. I have never once been upset that a patient came in early. I have, however, sat with families who wished their loved one had come sooner. There is a quiet dignity in paying attention to your health. There is strength in saying, something feels different. After 60, your gut signs are rarely random. They are messages. Some are small adjustments, some are warnings. But none should be ignored for months out of pride, fear, or embarrassment. Let me leave you with this. I have treated patients in their 90s who still laugh, garden, travel, and enjoy meals with family. Longevity is not only about years, it is about quality, comfort, independence. And much of that independence depends on maintaining your digestive health. So if you notice persistent changes in bowel habits, blood, unexplained weight loss, constant bloating, new abdominal pain, difficulty swallowing, or unexplained fatigue linked to digestive changes, do not panic, but do not ignore them. Make the appointment, ask the question, have the test, because catching a problem early is not just medical, it is life-preserving. I am not here to frighten you. I am here to stand beside you. Aging is not a disease, it is a privilege, and your body, even now, is trying to protect you by sending signals. Honor those signals, respect them, and remember, you deserve to feel well. You deserve clarity. You deserve care. If you are over 60 and you are listening to me right now, I want you to know something deeply. It is not too late to protect your health. It is not too late to act, and it is never too late to listen to your gut.